Thanks for coming today so we can talk a little bit about this fantastic weight loss program that we started at my office. Its name is Halsa. Halsa is Swedish for health and wellness. And we're really focused on engaging meaningful weight loss. And we've been very successful at the office doing that. So we want to talk about that today. But first, I'd really like to talk about what's going on with weight loss. Unfortunately, obesity is plaguing our nation, and it's a very complex issue, which is why I think we're having some difficulty in helping people lose weight overall. Our solution, we believe, is through healthcare and as medically directed. Now, sure, that includes things like surgery, but there are a lot of options here, and our solution, I believe, is the best medically. There are many areas that we look at where we need improvement for that, and these are things such as the president's, the first lady's Get Up and Move campaign, or the sugary beverages that are in just about everything we see these days. In addition to that, we receive a constant bombardment of food advertisements and marketing, leading to what we call the obesogenic society, which is a society where we're sitting down, we're reading books, we're in school, and we're not getting nearly as active as we need to be. And so the goal here is to really reduce that 192 billion in estimated annual costs of obesity-related diseases, or to really handle our more shocking issues, such as the fact that 2 out of 3 people are overweight in this nation, and unfortunately that trend continues as a full third of children are listed as obese. So how do we do it? How can we really begin to help engage weight loss? Well, we have to treat it medically. And what we found in my program is really there are 4 types of patients that have issues leading to weight gain and making it difficult to take it off. One of the big things we target is nutritional deficiencies. These patients just don't have the right cofactors required to burn fat. These are things like vitamin D or B12 or even chromium. In addition to that, we have a sick fat cell. The sick fat cell is something called an adiposopathic fat cell, or adiposopathy is another name for it. Unfortunately, the fat cell secretes about 168 different adipokines, which are cytokines that cause all sorts of problems with energy balance issues, make us resistant to insulin, they make us more hungry and not respond well to hormones such as leptin, which say we're full. In addition to that, we have issues like psychiatric illness, binge eating disorder, depression. How many of your patients eat to make themselves feel better and use food as a coping mechanism? Well, this is a long-term strategy that we've had issues with since childhood, right? You get rewarded with food. There's a birthday party with food. And unfortunately, the spike in sugar really leads to a sort of craving. In addition to that, we have patients that have much more difficult issues. And at Halsa MD, we'd like to refer those patients that have real psychiatric illnesses out that will need your help here. In addition, we really focus on controlling insulin levels because insulin can prevent fat burning or lipolysis 95 to 97%. If your insulin's high, you're just not going to fat. Lastly, we know that a whole host of different comorbidities can prevent exercise. Simply obesity itself can cause shortness of breath, have sleep apnea, give you knee and joint pain, which will prevent exercise. In addition to that, we have things like high blood pressure or high cholesterol or heart disease. So again, we really need your help to manage a lot of these things so we can handle weight loss, because weight loss is really hard. Recently this year, the American Medical Association diagnosed obesity as a disease, and I have to say, well, it's about time. Well, guess what? Because it's a disease, shouldn't we really treat it medically? And here we have, at our office, we've treated over 250 patients, and our program is highly successful. In addition to that, the patients that have been in the program for over a year have kept 30 pounds off, which is fantastic. We do a very specialized and personalized treatment, which includes personalized calorie counts, customized treatment plans with exercise programs, with intensity, duration, and quality. We use molecular and mitochondrial therapies to really get at the heart of those sick fat cells. And more importantly, we accept nearly all insurances. Lastly, I just want to say thank you for coming today. we really need the community doctors because it's so important to have a healthy community. In our case, these are some of the issues that we encounter, whether they're cardiovascular diseases or orthopedic diseases, whether these patients have fatty liver disease or sleep apnea. We need internists, we need pulmonologists, we need heart specialists, we need surgeons, and we need psychiatrists and people that can handle all of these comorbidities to help us be that much more effective. Thanks again, and feel free to email me or call me if you have any questions.